I strive because I worked in dialysis for 3 years and I hated seeing my patients on dialysis. I am a former dialysis patient myself, but I am almost 8 years post-transplant. I strive because my dad is now on dialysis. I love what I do as a kidney navigator, and I just hope to see this company grow and help more dialysis patients.
I strive because I have a passion for kidney disease patients. So about a year ago in 2022, I met a patient at my previous job, and she was on the transplant list and had been on the transplant list for 3 years. So when I met her and I found out her story and how she was in need of a transplant, I looked into it, found out we were the same blood type, and signed up to be her donor. So a couple months later, went through surgery and donated my kidney. So I feel like I have kind of an in-depth knowledge about what these patients go through and all the difficulties that they have to endure throughout the transplant process, as well as dialysis and kidney disease. So that is why I strive.
I strive for Dave Thomas, my best friend from college, who is a kidney transplant recipient.
I strive for my uncle, who was on dialysis for a long time before he passed away a few years ago, unfortunately. I also strive for other family members that I have that are either dealing with CKD or other issues related to their kidney health. And lastly, I strive for all the patients that I've gotten the opportunity to speak with in dialysis clinics that shared with me all the hardships that they've had being on dialysis and how much they wished they had support earlier in their health journey.
I strive for my best friend who is a kidney transplant recipient, and for all of my patients that I took care of in primary care who felt that their needs weren't being met and they didn't have enough time with providers or other healthcare workers or clinicians, and I'm so happy to be here to be able to provide that service for them.
I started striving at first because I think that everyone should be entitled to health care and be taken care of for the diseases that they had. And then when I started working here, I started striving for different reasons. I strive, one, for our patients that I've got to meet, and I strive for the providers that I work with every day, knowing how much they go through and knowing how much we help them. So now that really makes me strive. And just meeting people that suffer from kidney disease and learning that people in my family have kidney disease that I never even knew about. And now I can help them.